Good evening and welcome to blackdoctor.org. My name is Shamika Rhymes and I'm your host this evening. Let me know in the chat where you are watching from and how you're doing so far this week, especially with the time change. So, March is National Kidney Month. And so tonight we're going to take a dive into an incredibly important topic, which is testing and screening for kidney disease. Now, this is part one of our kidney awareness series right here on blackdoctor.org. So, make sure you tune in for part two on March 25th. So, like I was saying, this is part of our kidney awareness series. So, kidney disease affects millions of people, often without obvious symptoms, which is why early detection and regular screenings are crucial. So, we've gathered a panel who are here tonight to share valuable insights on how to recognize risk factors, the importance of testing, and how screenings can help prevent further damage to kidney function. So, make sure that you share this with your network. And also, if you have any questions at all tonight, drop it in the chat and we'll try to get to those as we move along tonight. So let me introduce you to tonight's panel. So first up, we have Dr. Shirley Leon. She's a physician specializing in nephrology. Hi, Dr. Shirley. Well, Dr. Leon.
Hi. Hello.
Thank you for joining us tonight. We've got patient advocate Sheila Jackson joining us tonight.
Hello.
Hi, Sheila. Welcome.
Thank you.
We've got patient advocate Nashiki Chandler. We call her Coach Chandler. Welcome, Coach Chandler.
Greetings.
Thank you for joining us.
Thank you.
And then we also have patient advocate Kim Delaney joining us tonight as well.
Hello.
Hi, Kim. Thank you for joining us.
Thank you.
Well, I think this is an important topic, as I was saying. So I think tonight we should kick this off with Dr. Leon, and then the rest of you, feel free to piggyback on anything that you want to jump in on. But why should kidney health be a priority in the Black community?
Yes, thank you for having me. This is a topic I'm very passionate about. So just in general, even before we talk about the Black community, we have 37 million people with chronic kidney disease. Okay, that's the number. And that means 1 out of 7 people have kidney disease. We, unfortunately, as the Black community, are disproportionately affected because of the high rates of hypertension and diabetes. Okay, so diabetes is the number one cause of kidney disease, with hypertension being the number 2. So 1 in every 3 people with diabetes will have kidney disease, and 1 in every 5 person with high blood pressure will have kidney disease. So yes, it's a very serious matter in our community.
Okay. I think we should also start with what is kidney disease, because that might be helpful for those that may not know exactly what it is.
Right.
Dr. Leon,
so,
can you explain that?
So you often find that people, you're right, they do not even know about the kidneys. So we each, hopefully are born with 2 kidneys, 2 functioning kidneys. The kidneys are very important, and we call them the filter of our blood. So they clean out all the toxins and they regulate a lot of different things that our body needs, like making our red blood cells, keeping our bones healthy, regulating volume control in our body system. So so the kidneys are very important. There's 2 of them. They're very silent. Sometimes you won't know that you have kidney disease until the very, very late stage of kidney disease, which is unfortunate. So again, we're going to talk about the reason why it's important to have a physician and to get screening and things like that.
Thank you. Did any of my other panelists want to weigh in on why it's important that kidney health be a priority in the Black community?
So I think that she highlighted some very important factors, and that's in the fact that people with diabetes and hypertension are often the top at risk for it. So for people that are suffering from those conditions, it's something for them to be aware of and be very proactive about getting tested for and getting some assessments of their kidney functionality. What I found is that often people can get an understanding early on that they have reduced capacity at 70% or 50% before it gets to the level where it's concerning. And at those levels, some adjustments can be made to prevent official renal failure. And so I think for the people that have been diagnosed and that are living with those conditions, this is something for them to be very, very mindful of and to be on the lookout for.
Thank you.
Yeah.
Okay. Well, Dr. Leon, what are the most common kidney diseases that affect Black individuals? Because I don't know that everybody knows there are other kinds of. I mean, we just think, oh, there's just one kidney disease. That's it.
Right. So it's kind of like a little beyond the scope, but I will comment. So for example, I think because we're looking at the panel, we're a panel of women, so I will mention, for example, a lot of patients with lupus nephritis, they have lupus and that leads to kidney disease. There's IgA nephropathy, which is where you have a normal variant where it's like the IgA molecule is supposed to help you fight infections, and it instead attacks your kidneys, and you find that accumulating in your kidneys, and it's kind of like an autoimmune, like your body's fighting itself. Then also for women being at risk for kidney disease in general, because of sometimes you develop preeclampsia in pregnancy, and then that leads to high blood pressure, which then puts you at higher risk for kidney disease. Let me see what else. If you're a smoker, all right, so if you're a smoker, that also puts you at increased risk for kidney disease.
Okay, thank you. What are some key tests used to check kidney function? Dr. Leon, back to you.
Oh, I really appreciate it. So I mentioned earlier, right? We should all have a primary care physician. So I know people love to go to the emergency room. People love to go to urgent care. I highly, highly discourage that unless it's like you have no choice. I being a physician who loves being a physician, thinks everyone should have a primary care doctor, where your primary care doctor and you are partners in your care, right? So you have a diagnosis, or even if you're healthy, I tell my residents when I'm like, you turn 30, go have a doctor yearly. Like just go get your tune up, just around your birthday, just make that appointment, just get all your labs done. So so first you have to have a primary care doctor. Okay. Once you have your primary care doctor, you get your blood work done, yearly or every 6 months, depending on factors like, insurance factors, all that. But when you go to the doctor, they do blood work, and you may not understand all the different things on the blood work, but for the kidneys, we look at the GFR, right? And so that's the number that Coach Chandler had mentioned about the capacities and the levels. So there's different stages of kidney disease. So if your GFR is like a 30 to 60, that's stage 3. Okay, so most people I was meeting when I was doing kidney disease clinic were coming to me at stage 3. That's also normally sometimes where the primary care doctor will refer them to a specialist. Okay, and then once you're at stage 3, like Coach Chandler mentioned, you can do things like if your diabetes is not controlled, you can get that thing under control. If you're not taking your blood pressure medications, you kind of like get it in check because you're really on the fast track to dialysis or end stage renal failure. So that's one number. Another number when you have diabetes is they check your urine for protein. So if you start leaking protein in your urine, that's also very concerning. That means that filtration system that I talked about, that normally just, does a very good job of filtering, is now getting like leaky, and your, protein and stuff is leaking out. And then that's causing severe, like progressive damage. Also, with checking with the proteins, you'll find that if you have diabetes, if you have high blood pressure, it also puts you at risk for heart disease, right? So then you might see that because the kidneys are unable to regulate the fluids, you have leg swelling. Okay, so you also will see a decrease in your either urine production. So there are things that you can see symptoms wise and then lab wise. So it's the protein in the urine, the GFR. If you're progressing to end stage renal, and sometimes like I tell people when I'm speaking with them, a lot of the patients I meet them in the emergency room for the first time, telling them you're about to start dialysis. And then at that point, they have their potassium level, which is like one of the first markers that's really, really elevated. And that's because, again, the kidneys is unable to clean and filter out the blood, and you find that these numbers are elevated. So if you're at the clinic, though, it's very rare, but you find that you're meeting a patient for the first time, and they're like stage 4 or very close to stage 5, not really requiring dialysis yet because their symptoms are managed or not worsened. But so the labs, we can tell a lot from the labs.
Thank you. Thank you. I wanted to, because one of the things that I have learned here in the past few months that I've been hosting these is that storytelling is huge. So people often relate when patients share their story. So I wanted to pause for a second and get our patient advocates to share their story. Sheila, I'm going to start with you. Can you share your story and including your screening process, like everything that happened with that and the diagnosis and everything?
Yeah, so almost to piggyback what the doctor was saying, that happened to me. I was 17 years old. I just graduated from high school, and didn't have a history of high blood pressure or diabetes, but I had the swollen feet, and my mom said, something's not right. So my parents took me down to the emergency room, and after blood and urine tests, they said she's spilling protein. There's something going on with her kidneys, and we're like, what do you mean? What are you talking about? And so that was really my only symptom was the swollen feet. And so they were able to manage my kidney disease, my chronic kidney disease with like medications, some diet changing. But, within a few years, I did reach, by the time I was around 21, 22, I reached kidney failure and I started hemodialysis. So yeah, that is how my story went. I was diagnosed with focal glomerular sclerosis or FSGS. That means it's something genetic, but not necessarily something passed down in the genes like polycystic kidney disease, so to speak. But yeah, that was my diagnosis.
Yeah, thank you, Sheila, for sharing that. Kim, can you share your story?
I feel like my story is so much longer, but
That's okay.
so I'm a little all over the place. So I actually fought multiple myeloma and amyloidosis. So I already have, the blood issue and the amyloid protein that was kind of against me, but was in remission, was doing well. But I think my saving grace is your body tells you when something's wrong. And so I still see my oncologist, even though I'm in remission. And he continually does my labs about every 6 weeks. And we just noticed that my creatinine kept kind of escalating a little to the point where he was concerned. So my blood pressure, I have preeclampsia with both kids, but after my second, it didn't truly come down. And so we were kind of already looking at both of those things. So after probably, I don't know, 5 or 6 months, he was like, you know what, I'm going to go ahead and refer you to a nephrologist. Went to the nephrologist. Still blood pressure was concerning, but it was like, okay, we're going to watch it. We're going to watch it. And literally I had went to Atrium. I'm very involved in the community. Had went to Atrium for like a leadership day, and we were downstairs in the basement, and it's just a spiral staircase. Never been a really small chick. So, but I shouldn't be out of breath going down a staircase. And so that was another thing. I'm like, I feel horrible. Prior to that, maybe 2 weeks before that, we had restarted chemo because my numbers had started trickling up a little bit. And because of the amyloid, my GI system is very sensitive. And so I called my oncologist. I said, I don't feel well. Like I cannot breathe. He said, well, we stopped chemo. Like it's out of your system. So, and he knows I'm not wanting to complain. So he says, if you feel that bad, you need to go to the ER. So Dr. Leon, I don't do the ER either. I don't do urgent care. Honey, I go see my doctors. We have a relationship for real. So I was like, absolutely. So packed my daughter up. We went to the ER and they were like, so we're going to check you in. I thought I was going to die. I couldn't breathe. And one nurse thought like I had water or fluid on my lung. And so they started treating me for that. And the doctor on call immediately like rushed in and was like, that's not what's wrong with you. Like, take her off of that. And I left there with the freaking catheter in my stomach. So I was not prepared for that at all.
Wow. Thank you for sharing that. Thank you, Kim. Coach Chandler, how about you?
Wow. I had to pick a story. So what I'll say, the story that I'll tell is one regarding hypertension, because I've had a number of people that I've had to work with that were facing some degree of kidney functionality challenges. And so there was a situation where the person had hypertension and it was going unregulated. Sometimes our people don't want to take the medication because they feel like if they take the medicine, they become dependent on it and it actually makes them worse or weaker. And so, and they don't understand that if it's unregulated and they don't take the medication when their body is needing it, that it can fast track them to some degree of kidney failure. So I have to have that conversation often. But in the case that I'm thinking about, this person was on medication, but it wasn't the proper dosage. Also, sometimes I think we need to go back and get a reassessment to see if the medication is appropriate, because some medications do have contra effects when it comes to kidney functionality. And so in this case, the person started having the potassium levels being out of range, either too high or too low. And this was happening for months. The creatinine level was high for months, but still never an official concern about going into renal failure. So by the time this person found out that they were in renal failure, they were in end-stage renal failure and actually in the emergency room after several visits. So what I like to say in all of the stories and everybody that I end up having to advocate for and advise is know the indicators, know the tests, be able to look at the creatinine levels of your own tests. If you're having leg cramps, which was a huge telltale sign for that person, she had been having leg cramps for months, just random cramps in her legs. She had never had that before, but that was one of the signs of her body letting her know that something was off. And so in addition to having a primary care physician, also know some of the tests that Dr. Leon has mentioned here and know some of the key indicators so that you can go and look for yourself. And then for people who may have concerns about their insurance, where they're not able to get tests as frequently as they would like, definitely go to your primary when you can go. But if you can't go, there are other resources like any lab test. And there's another one where you can order labs online to where you can be testing yourself, or you can go get this blood work more frequently if your insurance does not allow. That way you can be monitoring yourself so that you can get in the driver's seat and truly partner with your doctor and say, hey, I've been checking for the last couple of months, and here's what I have, and this is where I was when the last time I saw you. Here's what has happened since I saw you, and that way you truly can partner with the doctor to make sure that you're on a good track, because you don't want to have to be in the emergency room or in the doctor's office getting that information when it's too late. So that's the story I like.
I would like to say something, Shanika.
Okay.
I'm sorry, Dr. Leon, would you want to say something?
No, go ahead. You can go ahead first.
Okay. So with a lot of the hospitals, I know they use my chart. So like I am always on my app. I will look at I'll compare my different labs throughout time. If something looks funky, I'll immediately text my oncologist and we talk through it. I've been with him. My daughter is almost 10. I've been with him almost 11 years. I joke with my friends, that's my longest relationship I've ever had. But that's like there's no secrets. But I will say, I think with my age, I definitely didn't know the signs. I feel like clearly I didn't pay attention in science, biology, chemistry, nothing, because it's like I had no idea what kidneys actually do. So as you talk about signs, I'm not sure people would even think like, oh, something was wrong, or oh, it must be this. And those leg cramps, girl, you minimize that. Those leg cramps are like a Charlie horse times 10. Them things will not only wake you up out of your sleep, but my legs will cramp for days after. That's how tight it is after you loosened up. So I was just going to say, like, that's my biggest takeaway is I think you just don't really know, like, heart attack will really see that into it, like check for these signs. But for kidney, you don't know.
Mm-hmm. Yeah. And unfortunately, a lot of us don't know until it's too late. Like for me, when I was first diagnosed with chronic kidney disease, I was, okay for a while. But then when I started to really get sick, like I would sleep at the drop of a dime. I was having chest pains just walking from my car to the house and getting those labs done. Even I have a transplant now, I get labs done once a month. And so if anything seems like out of range, hey doctor, what are we going to do about this? Is this something I need to be concerned with? And he say, yes, okay, let's change your medication, repeat your labs in a month or in a week or so, like that. So in my chart, I'm a big fan of my chart as well. Get my labs done, even with the transplant now. Every single month I get and I look at all those levels, and whether I know what they mean or not, but if something's out of range, I'm speaking with my doctor about it for sure.
Yes. I wanted to comment on two things. So Coach Chandler mentioning, getting the labs and things on your own. So I'm also an independent healthcare advocate. Okay, that's how much I believe on both sides. So as the physician, I understand, and as a patient and patient advocate, I also understand. So when you tell patients to try to take control, I get it and I support part of it, but at the same time, it can be very because if you have a chronic diagnosis, like if you have a diabetes or a hypertension, I really, really strongly believe that you advocate for yourself and you work with your doctor. And insurance shouldn't be a problem seeing your doctor on a regular basis, because if you go and you get labs, like for example, if you don't have a chronic disease, or you're just like, oh, I just want to check my labs, and you find that you have your creatinine bumped up, right? And you're alarmed, it could be unnecessary alarm, because you can have acute kidney injury. For example, if you get COVID, or if you get the flu, or any illness can cause a bump in the creatinine. And then it stabilizes, like it'll go back to baseline. But I'm more for like the people who have like a chronic condition. Yes, you should be sticking with and checking with your doctor on a regular basis. And how Miss Kim was saying with the symptoms, right? I'm gonna share a story now. I realize I have a short story to share. So, when I was pregnant, a whole physician, guys, I'm having this headache, and I'm like, why am I having a headache? 2 days of headache. I didn't even think to call my OB. I'm a doctor. So you see, that's why I'm like very forgiving of the patient. It's hard to be a patient, and I get that, right? And I call with my friend. They're like, did you call your OB? I'm like, that's a great idea. I call my OB, and they're like, did you check your pressures? And my pressure was 190. So I developed preeclampsia during my pregnancy, right? So yeah, so I get it, like what you were saying, like the symptoms and paying attention, and trying to really be in tune with your body is a challenge when you're a patient, because you first of all, you want to minimize, right? Like, yeah, maybe I did this, maybe I did that, like it couldn't possibly be my my list of diagnosis, right?
Right.
Yeah, and then the medications that you were mentioning, Coach Chandler, also, yes, it is true that when patients are on medications, that they should revisit, especially as the kidney function worsens. And sometimes you do find that because, right, physicians, or some of them, don't realize they are human, right? No, God's here. And so, yeah, you should take an inventory, yes, and taking, control of your medication list, and knowing, I try to educate the patients too on like certain side effects or things, to look out for, right? Like you mentioned, there is a medication that you can be on for diabetes to prevent the protein progression that can cause the potassium to go up as your kidney functions worsen. And then some of the medications, like for people with heart failure that causes you to urinate, it can cause your potassium to go low, right? But if I never tell you, like, like if I don't tell you what to look for too, you wouldn't know, right?
Okay.
And I think that's a good point of the doctors telling patients what to look for, especially if they're in that high risk community.
Yeah.
Hypertension, diabetes. Many people who have those diseases do not understand that those are the two top reasons for
Exactly.
kidney failure.
Yeah.
And so if the education is introduced where they know, hey, yes, you have this diagnosis, but
Yes.
there's worse.
Yes.
And here's some signs to look out for. I think that would be monumental in our
Yes.
community.
And you just reminded me of something else. Thank you for, yeah, I love it. So, like, I think Miss Kim was saying, right? If I say fast, fast, right? Stroke. If I say go red, right?
Mhm.
Heart, right? Even colorectal cancer has different, teal color, all this, right? What's the kidney? What's kidney's color?
Orange.
Okay, yes, very good. And this Thursday is World Kidney Day.
Mhm.
Okay. And the theme is, are your kidneys okay? Right? We should be asking this of everyone. Like I told you, 37 million people walking around with chronic kidney disease, and about 9 out of 10 don't know, and 1 in 7 have it, right? This is scary. So I agree with you. Same thing. If you have diabetes and you have hypertension, you need to know your risk for kidney disease is very, very high. And then once you get kidney disease and end stage renal disease, your risk for cardiovascular disease is like, I believe, I don't want to quote wrong, I think it's like 4 times or 3. It's crazy. Okay, so this is serious.
Yeah.
Wow. Well, how often should people be getting screened? I know we've mentioned, if they're on medication, they should be getting screened regularly. But if it's someone that just only, they just don't think I feel okay, I don't have any symptoms, but should they, like, how often should they really be going to get screened? Just during their annual exam, or?
So if I believe if you have diabetes and hypertension, I think you're supposed to see, this is like ideal. I think ideal. I'm an idealist. Every 3 months, but I think sometimes they push it to every 6 months. That's if you have a chronic diagnosis. If you're relatively healthy, right, you go to your doctor. Like I say, I love the around my birthday, right? I want to be healthy. I want to be around. So you just put in the calendar, right? The week before, the week after, whatever, and you see your doctor yearly. And as you age, that things come up. So you should definitely be seeing your doctor yearly. But if you're like 21, oh, actually, before I say that, so another story to share, when I was in fellowship, I started a 35-year-old on dialysis from hypertension. The person learned that they were hypertensive on their pre-college, like their college screening,
Oh,
but they didn't understand what it meant. So they never went to a doctor. And then at 35, they presented in like fluid overload, the high potassium, all that, and starting dialysis. Yeah.
Wow. What are some other, I know it seems like sometimes people just like Coach Chandler and Kim were mentioning, sometimes those warning signs you just kind of overlook it. What are some other early warning signs that could potentially signal like, hey, you probably need to go get checked? Because people, we get busy, we start thinking, oh, I'll just take ibuprofen or something, it'll be fine, and just not think about it, or start juicing or whatever it is, whatever you find online, thinking this will help. But what do you say, Dr. Leon?
Like I said, stroke, hypertension is the silent killer. Kidney disease is very silent. When you're getting the symptoms, it is too late. When you're getting that funny taste in your mouth, when you're getting the leg swelling, when you're getting those cramps, that means it is too late, unfortunately. That means you're in like likely stage 5, right? And yeah, it's really sad. But yeah, there's no, I think, like I said, it's prevention, right? So, you know, what we're putting in, right, with the diet. I really think, we have to shift our focus on our relationship with food and seeing food as medicine. And I know there's a lot of, like, I always talk about this too. Like, I know there's social determinants. I know there's, food deserts. I know there's food insecurity. There's a lot of factors that prevent us from being as healthy as we want and having, the things that we should have. But it's really prevention, like, prevent, not even getting the diagnosis of the hypertension and the diabetes. And when you do have them, once you get that, diagnosis, to really shift how you're going to tackle, and live with the disease.
Mhm.
That's what to kind of tap in on that. I did that dramatically after I got in remission. I'm talking like my hair is natural, eating cleaner, I'm vegan, like all the things. And so when I ended up going to the ER, my son is very like chill. He does not. I mean, he speaks very loud, but that's not it. He was going off in the hospital. He was like, "Why are you vegan? Why are you trying to do all this stuff to be better? And like you're still sick." I'm sure, of course that was from his pain, but valid choice yet. But like you said, there's other factors, other variables that plays into that. But I do feel like definitely food is medicine. It makes me super frustrated now because my diet almost interferes with my treatment. So for a long time, I had issues with what's the two P's? The potassium and phosphorus.
Phosphorus. Yeah.
Phosphorus.
But here lately, like the past 4 or so, it's been like I gotta watch what I eat. Like I can't do mangoes, I can't do plantains, like so some of my favorite things, even my salads. Just being careful with all that. So like that's kind of that's just I guess like I don't know what the word I don't want to say not depressing, but like it just kind of hampers your spirit when you have tried to do the things to be better. But especially in my circumstance, I think the odds are just so different and unique that I feel like I don't really have a playbook like maybe other clients do, but that's just my opinion.
Well, that brings up another point that I just thought about, the mental health aspect of finding out that you have kidney disease. What does that look like for you, Sheila? What did that look like for you when you found out? Because you were what, 17?
Yes, I was. I first went to the ER when I was 17, and I got around my 18th birthday. I had a biopsy done, and that's when they found out my true diagnosis. And that was just like, I'm supposed to be partying. I'm supposed to be getting ready for college. What do you mean? I have to stay behind to figure out what's going on with my kidneys. Like, I'm supposed to graduate, get married, have the kids and the dog, that kind of thing. Like, and now I have this disease I can barely pronounce. No one never heard of. How do we treat this? So yeah, that was like pretty devastating for me and my parents because I'm the baby girl, I'm the youngest, and I was pretty young, and so even when I started, I was able to go to college and things, but by my senior year, I reached kidney failure and I had to start hemodialysis. So here I am, my last year of college. I'm in the class from like 9 to 3, and then I'm dialyzing Monday, Wednesday, Friday from 4 to 7. So I'm like trying to study in a dialysis chair. Mm-hmm. I'm trying to plan a wedding. Like I'm trying to like shift my dialysis schedule so I can get married on a Saturday. Like, all these things that I had to plan around when I reached a kidney failure. So it was like really, really hard to deal with, but I had a good support system. My parents were just like, you're not doing this alone. Like you're not going to the doctor alone. We're going with you. They're my big support system. So I'm very thankful for them.
Thank you. How about you, Kim? Well, you kind of just mentioned, Kim, that it does play on your spirit, especially even with the food. Like, and then I know your journey, just condensed it a little bit, but I know your journey. So I'm like, it has to have played a huge or had a huge impact on your mental health.
Oh, absolutely. So, I probably like most women, most Black women, think you're so resilient until the world just keeps crumbling. And I remember having a conversation with my kids first, and that was probably the toughest part. So we're there watching the educational videos that they send you, and we're just kind of talking through it and what it looks like, and we're crying and hugging and all the things. And if nothing else, just mad because it's like I just keep fighting. But I also know my kids are a blessing. I'm not sure. I'm a very strong person, but I feel like they give me that extra desire to want to be here. And so even here lately, so I'm about 2 years in. I'm active on about 5 lists right now. I'm actually headed to UNC and Duke the end of the week, but it's starting to get harder because I'm tired. I'm tired of being on the machine. I do it at nighttime every night. Like it's a lot. Yeah.
Mm-hmm. Yeah.
I'd like to speak to that.
Yeah.
What I've seen happen firsthand is the first thing that happens is shock. Mm-hmm. Because the people that I've worked with and experienced going through that process, they're finding out when they've done the things. They were going to the doctor. They were doing the things that they thought would make sure that they were okay.
Mhm.
And so shock was a major thing. And that lasted for a while. And then the next mental health challenge was the processing the fact that you need this machine in order to keep living, which
Yes.
means that's a form of life support. You just get to go home or you get to do it at home.
Mhm.
And so, even in that, with going to the actual dialysis treatment centers, the side effects of getting the treatments, the itching, the not being able to sleep, that magnified depression around the fact that I'm never going to have a normal life again.
Yep.
Everything I do, plan, eat has to be centered around the fact that I have to use this machine. I have to change so many factors in order to just keep living. That's an everyday fact. So that is a major mental health challenge to understand. It's a huge possibility that I'm never going to get better.
Right.
So I want to just drive that home. And so when Dr. Leon talked about when a person has been diagnosed with hypertension or diabetes, that's your opportunity to truly shift. I really want to stress that because I think we have a culture of, I just have to keep going.
Yeah.
Whereas they may remember a family member, a mother, a dad, a grandmother that may have lived with those diseases and they just kept going, kept going. Now we have so many other factors that work against us. And so when someone is diagnosed, that is the big warning sign. If there's an official diagnosis of hypertension or diabetes, this is my time to make my life about me being the healthiest version of myself possible, mentally, physically, and emotionally. Because the journey of shifting is worth it to prevent being on a form of life support because there is no normal when you get to that. So I just want to stress some of those things that are major factors when it comes to mental health.
Thank you, Coach Chandler. I'm curious, Dr. Leon, how does kidney disease affect other organs in the body?
Before we go there, I want to talk about the mental health impact,
Okay.
right? Okay, yeah, I really think it's important to give the doctors a chance to also share that. And I think sometimes it's overlooked. So imagine me, right, as a human, decide
Mhm.
to become a physician to care for others. And you're feeling that it's like you're fighting against a losing battle, right? Because the number just keeps going up and the many patients are crashing into dialysis in your emergency room, you know. So after fellowship I actually stepped away from medicine
Mhm.
because when I started that 35-year-old on dialysis, I'm like, I don't think this is it. I don't think this is what I want to be doing, starting people who are younger than me on dialysis, right? So I stepped away and I went and got my MPH and I was looking at, I did a preventive medicine residency because I kind of like wanted to, again, shift the focus on that prevention.
Mhm.
And even though I love medicine, I love clinical medicine, but like Coach Chandler is getting it and most of, us are hearing it. It really is those chronic diseases that funnel into the kidney disease are serious. And I don't think people understand that, right? Like, and so, yeah, so for me too, as a physician who cares for a population and I'm seeing the people that look like me, are, disproportionately affected. And a lot of the stuff, again, I talk about the social determinants, I talk about behaviors, right? No blame. When I talk to my patients, I'm like, there's so many factors, right? There's the FSGS, there's the IgA, there's the lupus. And then we have the hypertension and the diabetes that, yes, we can choose differently. We can do better. And so those get me frustrated and those get me depressed. All right. And so,
Mhm.
yeah, I just wanted to step back and allow you to, to hear it from that side too. Right. Because sometimes you just feel like it affects us too, because we feel like we're fighting a losing battle.
Mhm.
Yeah, thank you for sharing that aspect because I do think we tend to forget that doctors are human. Yeah, for sure.
Thank you. Thank
I,
you.
I just want to jump and say thank you, Dr. Leanne, for sharing that as well, because I know, like when I initially met with a transplant coordinator, she's talking to me about all these things to process, and I think I just had a look on my face, and she's like, Miss Jackson, are you listening? And I just lost it. Like I just started crying in her office. Another coordinator came and said, what's going on? How can I help? And what's wrong? And she's like, she's 22. That's all she said. Like she's 22. Like
Yeah.
here we are preparing this young person for dialysis and getting on transplant. She's 22. And it just kind of hit me like a ton of bricks.
Yeah.
So yes, from the medical staff, thank you for what you do, and because you too take on the burden of taking care of these patients the best of your ability. So
Thank you.
Yeah.
And I want to applaud you for sharing that and bringing the human side from the doctor's perspective, because sometimes it may appear that doctors have become desensitized. Right? If you're giving people that news every day, whether in a doctor's office or in an ER, when you're giving people that news every day, sometimes maybe to cope, it may appear that a doctor has become desensitized. Or if the doctor doesn't look like us, right? There may not be that level of connection, attachment. Oh, this baby is, this girl is 35, this baby is, 17. And so I think that's a good thing to share, especially to our community, because we have so many fears about going to the doctor.
Exactly.
mhm.
So
Thank you.
Yeah, thank
Thank
you.
you.
I was like, what question did I just ask? Oh, how does kidney disease affect other organs in the body?
Kidney disease affecting other organs or organ systems. So you have kidney disease, chronic kidney disease. As it progresses, you're going to have anemia, chronic anemia of chronic disease, because you're not making the red blood cells as you should. You mentioned the phosphorus and the calcium levels. All that regulation affects your bones. Again, kidney disease leads to or contributes to heart disease. You mentioned the pruritus, like the itchy, but then you also have patients where there's calcium buildup in the vessels. So then they start having like the destruction of their skin from the buildup in the vessels. Let me see what else. Yeah. It's like I said, it's a lot.
Okay. Well, Coach Chandler, you mentioned about the mistrust of some people have mistrust of doctors going to the doctors. What advice would you give to someone who might be hesitant to go get screened for kidney disease? What advice do you give, the patients that you work with?
The biggest thing that I focus on is when people are in a position where they are hypertensive or they have diabetes, I make sure that I start the process of educating them so they can know the level of severity or the level of attention that they need to give to that condition, because I think there's a major gap in the education around it. So that's the first thing. And then the second thing is when they're having like the headaches. I got a call one time, a guy had a headache for a week, right? And didn't want to go to the doctor. Just tell them. I just have to tell them. Like, try to find a doctor that you might be able to trust, whether that be get a recommendation from a family member. If they're local, I have a list of people. I live in Atlanta. I have a list of people that I can send them to. But once they start having certain symptoms or they come to me with certain things, I always recommend they go to the doctor. And if they get two things, try to find a doctor they can trust, and try to find a doctor that believes that they can actually get better or have a decent quality of life. So those are the things that I recommend. But I always stress that they go to the doctor so that they can get a full analysis done.
Okay. Thank you. How can, and this is for, I guess, for you, Dr. Leon, and anybody else that wants to answer this, but how can primary care doctors and specialists work together to improve kidney disease prevention in the community?
Right. So before we move on with the trust issue too, so I tell my patients, right, you see how we're all having a wonderful conversation here, right? You should be able to speak with your doctor.
Mhm.
If you're unable to be vulnerable with your doctor, if you know yourself too, right? Like we know, listen to your heart kind of thing, right? Like if you're feeling that they're being dismissive or whatever, you don't have to stay in a relationship, right? Like with that doctor patient relationship where you're not being heard. But it should be a nice flow of communication. At the same time, I'll comment that me as a Black woman physician make up less than 3% of the workforce, right? So there's not a lot of me, going around, right? So that's a factor. Um, but when you're meeting your doctor, even if they don't look like you have to kind of like set some, like guidelines, right? Like this is how I communicate, doctor. I need you to speak to me like I am not a doctor because I'm not, right? Like, like speak to me so I can understand. I need to maybe ask, a little bit more questions. Or, I may need to, when you tell me something, like, process it and then come back with my questions, right? So I think also, setting that, like goal, like tell, like explain to a person what you need, right? So I was joking earlier when I say, yeah, like I tell my patients all the time, I don't know. Sometimes I don't know. I don't, right? And then sometimes I'll find out, right? Sometimes I'm sorry, I was wrong, right? Okay. So you need to be able to have that, right? You shouldn't feel like you're going in there scared. Like you're going into like the principal's office that you did something wrong, right? Even if you had that ice cream bar, like I be having an ice cream bar, we're human, right? But it shouldn't be like that type of relationship. It should be like, okay, doc, I wasn't supposed to have that mango, but there was like a sale and then I had like 3 mangoes. But so when you check my potassium, it might be a little high, right? Let's start there,
Mhm.
right? And just be honest, right? Yeah.
I think also having an advocate with you in the room as
Yes,
well.
you know.
So sometimes when I speak to someone that's married, they may their spouse may come to the meeting, and so the spouse may remember things that
Yes.
they just don't remember in the moment.
Yes.
And so I recommend that if a person has a condition or concerns, take someone that you trust, that's close to you, that's been around, that's watching you, that may know your medical history. Take them with you as well so that you have another set of ears and eyes listening and asking questions on your behalf. Because sometimes in the moment when you're processing the information, especially if you're getting some bad news or what you perceive as bad news, you may just kind of, float away for a second.
Yeah.
And you may need a second
Yeah.
set of eyes and ears to help you navigate that to get to the best outcome.
And that's exactly why I, as a physician, became an independent healthcare advocate, right? Because that language, so I can translate, right? That communication. It's like you have like a doctor, I'm seeing you as a client, like not a patient-doctor relationship, but it's like I can translate or I can answer questions. I can even, help you figure out what should you be asked. Because you don't have the time, you're like, what's this diagnosis? What's this word? So it's the language too, right? Like the health literacy and understanding what's being said to you.
Mhm.
Absolutely. I do see in the comments, I guess they were answering the question on how primary care doctors and specialists can work together for prevention. Cheryl Walker says physicians and nurse practitioners should hold health fairs and clinics in African American churches, especially on the subject of diabetes and hypertension as well. Yeah.
I
So
believe we
what,
should have a whole campaign. I really believe that, like how, we have the Go Red and the fast and all that. Like, I think it's about time, because we do have World Kidney, and if you go to, if you Google World Kidney Day, there's like a whole organization around that. And this is a global issue. It's not only, U.S. issue. Kidney disease is a global issue. So I think we really need to do a better job of bringing awareness, like Coach Chandler is saying. Like, once you hear diabetes, you should be like, could it be? Could kidney disease be next? Like that's how it should just be so synonymous, right? You hear diabetes, you hear hypertension, you're thinking, how are my kidneys? Like, are my kidneys okay? And I think that's that new campaign that they're doing. I really support it and I'm a little encouraged by it.
This has been such a great conversation. And I still have more questions, but that'll have to wait for part 2. But for the as we wrap up, and I want to get each of your thoughts on this, what do you want the people watching to take away from this conversation today? And I'm going to start with you, Coach Chandler.
Education. So the biggest thing that I want people to take away is prevention and education, prevention of the hypertension and the diabetes. And then if you have those conditions, really be active in understanding how you can improve your health. I think sometimes we just don't take that serious enough. We think the pill is enough and I can just keep going the way that I've always been going. And that's not the answer anymore. And so definitely education. And if you have those conditions, make it a priority to learn how to take better care of yourself so that you don't have to be in a position where you get that bad news.
Thank you. Kim, how about you? What do you want people to walk away with tonight?
Trying to get my thoughts together because I knew you were coming to me. I would say my biggest thing is advocacy. And I felt that the first time I got diagnosed. And I think, like Dr. Leon said, it is truly, and I've made it apparent to truly have a relationship with my oncologist, with my nephrologist. Love my nurses to death. Nurses, I'm glad you said it about being a doctor, because nurses go hard. And I adore them for that. They know you like they're your auntie. They advocate for you. And so really having, and I think that's also that trust. But I will tell them in a heartbeat, this medicine is not working. Like this high blood pressure is uncontrollable. And I don't know what that means, but I know it's scary. So it's always been able to feel like I can use my voice. Number one is my time, my body, and my money. So really understanding that you are your best advocate.
Thank you. Sheila, how about you?
Oh, wow. So yes, prevention, self-advocacy. I'll add to that is for the people who are here with us tonight who may have been recently diagnosed or currently living with kidney disease. Please know that you do not have to go through this journey alone. It can be tough, but it's manageable. If you, prevention, talk to your family members like, hey, this is what happened to me. I need you guys to get it together. Advocacy. Yes, be a self-advocate for yourself in the doctor's office, and also be an advocate for someone else. Don't just drop off grandma at the doctor's office. No, go in there with her and listen to the doctor and figure out what's going on. And so, with that, to the people living with kidney disease, you don't have to go through this process alone. We can do this. We can do this.
Thank you. Dr. Leon, how about you?
No, everyone touched on a lot of the points. I would say definitely Coach Chandler and I are on the same page with the prevention and education. I think again we have too much information to to say, oh, I didn't know, or right. Like I think we're beyond that point. So I think we do have to be honest and own our health. Right. So it's not Dr. Leon didn't prescribe me this in time, or right. Because when you're coming to me and I'm finding the CKD3, I didn't do it, like, you know what I mean? Like I can't take the ownership of your health. It's a partnership, right? Once you walk into my office, we have to be partners and we have to be honest and have communication. I do a lot of tough love. All right, because I want to prevent you from getting to where you don't want to be, which is on a machine, right? So I think advocating for yourself, being able to use your voice, educating yourself, like Coach Chandler was saying, and then doing the things to prevent the progression or even getting the diagnosis of the hypertension, diabetes.
Thank you. I want to thank all of you for this amazing conversation. I know I've learned a lot, and I think they did in the chat as well. Thank you again for joining us for part 1 of this series. And I think some of you are coming back for part 2. So I'm excited about that to continue this conversation. Everyone, for more information on kidney disease, you can head over to blackdoctor.org for articles and resources there. And again, part 2 of our kidney disease awareness series, it will be on March 25th at 8 o'clock. So thank you again and have a wonderful night.
Thank you.
Thank you.